In the East Midlands, the council building new care homes. Derbyshire bucks a national trend with its latest specialist centre, but says it'll struggle to build more.
We're wasting money keeping people in hospital, which is expensive, when they don't need to be there, instead of coming to places like this. It's absolutely bonkers.
And it's looking like a stormy year ahead in politics, so we've got a special weather report on the political outlook for 2017.
Well, predicting the weather is one thing, but forecasting the political outlook, that's a real challenge. I'll be looking at what 2017 could have in store for the region's politicians, the economy and the big events coming up in the year ahead.
Hello, I'm Mary Ashby, and my guests for our first week of 2017 are Sir Patrick McLaughlin, the MP for Derbyshire Dales and Chairman of the Conservative Party, and Liz Kendall, Labour's MP for Leicester West. Welcome to you both. And first, we'll be getting reaction to something Jeremy Corbyn told us this week, and it appears to be an entirely new policy. The Labour leader told our political editor Tony Rowe that a Labour government would take over the cost of the private finance initiatives which have landed hospitals with billions of pounds of debts.
I do think PFI, frankly, was a big mistake. I think it would be much better to invest in those new hospitals by direct public investment. And I think that generally the public would agree with it, and I don't think anybody now supports the PFI idea.
So, Liz Kendall, was this a surprise to you?
Look, some of the early PFI deals were poor value for money, and I think it's important to look at that. But, you know, Labour delivered the biggest programme of hospital building in the history of the NHS, and we turned, you know, Victorian buildings into state-of-the-art NHS
But do
facilities.
you agree with Jeremy Corbyn on this?
I think it's important
PFIs?
to look at any deals that were poor value for money, but it's interesting, you know, the Health Foundation looked at this issue last year and they actually said that the cause of the financial pressures on the NHS isn't PFI, and I think the real thing we need to look at is getting more money into the system and look at the government's failures on the NHS.
Well, Patrick McLaughlin, the biggest PFI contract in our region is actually for King's Mill Hospital in Mansfield, which is a debt of £2.5 billion for a refit which cost £300 million. So surely it does make sense to effectively step in and write off that massive amount of debt.
Well, it's not a matter of writing it off. It's still got to be paid. I mean, what Jeremy Corbyn doesn't answer in that clip that he did for Tony was where the money's going to come from. So it's still a debt on government. I mean, I think Liz is a bit too sort of dismissive of saying that all the PFIs were great things and they've done marvellous things. There were some very bad deals, and we've been able to renegotiate some of those deals, but they are a debt around some of our hospitals and quite a big call on their finances, and that is part of the problem that we're having to address within the health service.
Jeremy Corbyn suggested it could be paid for, Liz, by borrowing money. Is that really a sensible idea in the current climate?
Well, it's right to look at any deal that is poor value for money. But the real issue we've got with the healthcare system is that we're not putting the money into social care, so elderly people are getting forced to go into hospital and getting stuck in hospital. That's not good for them, and it costs the taxpayer more, and the government has completely failed to address that issue.
But Liz, when you were fighting the last general election, when you were on the front bench, you failed to match our commitment to the health service. We were told by Simon Stevens that an extra £8 billion was needed. We've said we're going to put that money in. We are putting that money in. We will be putting that money in.
Simon Stevens said this week,
of course
the Prime Minister was stretching it to say that the NHS had got the money it wanted in. In fact, he said that next year, spending per head on the NHS will go down. That's the issue.
We're going to be staying with health.
With.
Let's move on now, because one East Midlands authority is bucking the national trend by building its own care homes for the elderly. Derbyshire County Council says it means it can help ease pressure on the NHS, but it claims that government rules will make it difficult to build more. Our political editor Tony Rowe has been to visit the council's newest care home.
The number of council-run care homes are dwindling. In Leicestershire, there are none. In Nottinghamshire, only a handful. But here in Derbyshire, they're taking a different approach. This is new.
Meadow View is built into a hillside at Darley Down near Matlock. Modern architecture for the elderly, and views, they say, are some of the best in Derbyshire. Daycare is an important part of what they do here. For Jane Morris, it's now a highlight of her week, making friends, meeting old ones.
I'm looked after very well by my family, but I like to be independent, and I found I couldn't walk, so independence had gone by the by then.
When it's first built, you do wonder what it's going to be like and what it is. And it wasn't until Mum came that actually you realise how good a service it is.
Meadowview provides specialist dementia care too, contributing to over 140 beds provided by the council around Derbyshire. But they also have beds which can take the pressure off stretched hospitals, interim care to get people ready to go home again, ready for independence.
This facility has got 16 beds, specifically to get people out of hospital, get them skilled and rehabilitated back up so they can go home and live independently again. Now, in a lot of places there isn't that facility, and people either languish in hospital longer than they should, or they go to a nursing home and sometimes never go home from there.
It's a £10 million capital investment here. They've kept control of social care. In Derbyshire, they believe they found a way which is best for the elderly. But the government, they say, doesn't approve and is making it hard to continue.
We will be struggling to do this again because we can't use the combined health and social care budget to support people to come out of hospital. So we're wasting money keeping people in hospital, which is expensive, when they don't need to be there, instead of coming to places like this. It's absolutely bonkers.
No, I remember when I was growing up.
Social care was missed out of the Chancellor's autumn statement. Then, last month, councils were told they can add an extra 3% to council tax bills to help pay for social care over the next 2 years.
Each 1% only raises 2.7 million. So we don't want, and it shouldn't be, a bill that the local council taxpayers pick up. It should be sorted out at national level.
But in a Commons debate this week, the Health Secretary, Jeremy Hunt, defended the government's record in response to criticism from the Shadow Health Secretary and Leicester South MP, John Ashworth.
Social care last year, spending went up by around £600 million. He stood on a platform at the last election of not a penny more to local authorities for social care. Not a penny more. To stand here as a defender of social care is frankly an insult to vulnerable people up and down the country, but particularly people living under Labour councils like Hounslow, Merton and Ealing, where they are refusing to raise the social care precept but complaining about social care funding.
There have been calls to take the politics out of social care, have an independent commission which discusses the best way forward in the future. The Lib Dems go as far as saying there should be a tax to pay for social care. Others say the real problem is years of cutbacks.
Patrick McLaughlin, you have to admit that Meadowview, which we were looking at there, looks rather impressive, and surely it makes sense to allow more councils to build homes themselves rather than relying on the private sector.
Well, Meadowview is actually in my constituency, you're quite right, but it was also under planning by the last administration, the Conservative administration, when the county council was being run by the Conservatives. And I thought the way in which the dismissal of the extra money when Anne Weston said that there was only 1% only raised 2.7 million. That's going to be an increase. Derbyshire can have an increase of over 8 million, therefore, in its social care budget next year. So the government is listening and has made and will make extra money available. Of course,
they are raising the council tax, but they say that still isn't enough.
Well, there's always going to be a question as to how much money you put in and how you use the resources which are available. That's always going to be a particular problem.
But could you see the benefit of what Meadowview was doing? It's in your constituency.
Yes, Meadowview, it's a wonderful place.
So why not allow more councils to build homes like that then?
Derbyshire has done that. Other councils can do that.
But it's not something that your government is promoting, is it? In fact, Anne Weston told us that they've been told they're being too ambitious with their plans. Even though they want to help ease the NHS problems, they've been told that it should rein back in, basically, from your government.
It's up to the local authorities what they do with their budgets.
Well, that's what they are trying to do, though, isn't it?
How they best use that particular care. And that particular facility is a fantastic facility, as I say, and it is actually in my constituency and I've visited it.
Liz Kendall.
Well, actually, the problem that Anne Weston, who's done a brilliant job there, is talking about is across the whole area, what they want to do is build facilities like that to keep elderly people out of hospital, and with any money saved, release that money from the NHS to put back into social care. But my understanding is when they put forward that plan, the government said no, makes no sense whatsoever. The government should be backing their initiative. And there is a real problem here with the government thinking that the social care precept can fund the gap in social care. In Derbyshire, just like in Leicester, the social care precept only makes up a third of the gap, and the real problem is poorer areas are less able to raise money from the social care precept. So in Leicester, we can raise about £6.50 a head compared to £15 a head in Richmond upon Thames. That's unfair. It will increase inequalities, and my constituents deserve better.
It's increasing inequalities.
Well, we've got to look at social care. We've got to look across the whole piece. We asked Sir Simon Stevens how much extra was needed for the health service.
You've got to stop repeating this. He himself has said that is wrong.
At the last general before the last general election, he said that there was an extra £8 billion needed. We've committed to put an extra £10 billion into the health service. People who are working in the health service are doing a fantastic job at the moment under very, very difficult circumstances. And this is something that has happened at different times of the year. There's always extra pressures on the health service in the winter.
But you say it's up to local areas to try and look at those problems and try and solve them. Nottinghamshire County Council passed a motion this week calling on the government to commit an extra £2.3 billion to social care, which is the amount that actually the King's Fund is saying is needed on top of what the government is currently promising.
Well, of course, I would expect Nottinghamshire County Council to pass a particular project like that and say it's got to be found by the government somewhere. The simple fact is we've increased spending on the health service, and obviously we've got to look at some of the issues which have come about as a result of some of the things we've seen over the past few months.
Ms Kendall, the government, Jeremy Hunt, is saying there's an extra £800 million in funding going into social care. And he is allowing councils to raise council tax.
Overall, we've seen about £4.5 billion cut from the social care budget since the government came to power. I want to see, Patrick, I want to see that money brought forward. That doesn't come on until 2019-20. I also strongly support a cross-party look at long-term funding issues for the NHS and social care.
Is that what needs to be done? Because this problem is bigger than party politics, isn't it?
I mean, it's always going to be political, but I actually think if you want a long-term solution, we're going to have to get round the table to discuss it. We've tried it before. You know, it's very, very difficult, but I've certainly supported calls from Norman Lamb and Dan Poulter, who used to be a health minister. Let's get round the table and look at it, but we do need an immediate cash injection because otherwise the system is really going to struggle.
Well, that extra money has been made available, and of course we've got to look at the lessons.
They're saying it's not enough, though, aren't they? The NHS is saying it's not enough. Councils are saying it's not enough.
We increased and brought forward we asked how much was needed. We committed to it.
Liz did
not commit to it when she was a Labour front bench spokesman at the last general election. They did not commit to that extra funding. We did. But we've got to deal with the situation we find ourselves. It's no good, really, in a way, this debate going back about whatever.
Exactly, I think the government is in denial about it.
A way forward needs to be found. A national settlement.
And that is certainly what we've done by the extra £600 million that Jeremy Hunt has announced, by giving local authorities, the local authorities the extra power that they can to raise finance locally and spend that money.
Surely it's time to get round the table, which is what Liz is suggesting, and other people are suggesting.
Well, we've had more reports on this. The last Labour government spent 30 years at a Royal Commission. You had a Royal Commission that you never did anything, you never followed through. So there was a lot of things. There's been more talking about this.
Are you saying you're not prepared to get round the table?
No, I think there's a lot that we can learn, and we need to listen to the experts, and we will listen to them.
I think the public get sick about this when they are in a ambulance outside A&E and they can't get to see their GP. They'd like us to get around the table, but the first thing the government has got to do is acknowledge what the state of the NHS and social care is.
Are you in denial over the state of the NHS currently? Is your government in denial?
No, of course it's not in denial. And we appreciate the tremendous work that both our doctors and nurses and frontline staff, the paramedics and people involved in the health service are doing.
OK. Well, you can see more on the state of the NHS in an Inside Out special programme tomorrow night at 7:30 here on BBC One. Now, as we've already seen, 2017 is shaping up to be quite a contentious year in politics, but what does it hold for the East Midlands? Well, one person used to predicting the future is East Midlands Today weather presenter Alex Hamilton. What you probably don't know is that Alex is also a massive political geek, her words, not mine. So we've asked her to do a special forecast looking at the outlook for the region's political weather for 2017.
Well, predicting the weather is one thing, but forecasting the political outlook is a real challenge. Let's start with the economy. In the East Midlands, we've seen some of the highest economic growth outside of London, but also some of the lowest wages in the country. Some say Brexit will bring sunshine and blue skies, but others say an economic rainstorm will dampen the region's commercial prospects. Several Labour MPs mutinied against Jeremy Corbyn last year. Now, the winds of political change could blow through the revolving doors of Westminster again, but some familiar faces from the East Midlands may have to stay out in the cold for a little longer yet. And the Conservatives? Well, there was an icy reception for some East Midlands MPs in Theresa May's new regime, but could a thaw be in the offing? Reshuffles are notoriously hard to predict, but in the climate of Brexit, that carousel of high and low pressure around the cabinet table will intensify. Anything is possible. Then there's HS2. It was a foggy picture for much of 2016. Toten or not Toten? Which route will they take? When will the buildings start? Well, whether that blanket of fog lifts or not in 2017, the issue is so complex it's likely there'll be some mist patches surrounding the finer details for some time yet. And what about the electrification of the East Midlands rail services? Will we be able to get to London at lightning speed? Or will there be a storm over delays to the project? The government says it's committed, but East Midlands MPs on all sides are suspicious it's dragging its feet. And talking of rail, building has now started on the rail freight interchange near Castle Donington. It promises a jet stream of jobs for the East Midlands. 7,000 is projected, but opponents warn of a tornado of environmental problems. And what of devolution, or the lack of it here in the East Midlands? It was a confusing year with occluded fronts on all sides, and a failure to agree with neighbours has left plans for a North Midlands combined authority blowing in the wind. Meanwhile, the sun shines on a devolution deal in the West Midlands. Perhaps the spring will allow new plans for our region to blossom. As we've been hearing, health looks set to dominate the political weather. Dark clouds seem to gather over some of our local hospitals in 2016. Warnings about the closure of Glenfield's Children's Heart Unit in Leicester and a review of several smaller hospitals could bring changeable conditions for patients. We'll have to stay tuned to the forecast to see how both situations develop. A&E units are under pressure, and EMAS was named the nation's worst performing ambulance service for hospital handovers. A blizzard of calls in the new year stretched the service even further. If the inclement conditions continue for EMAS, tough budgets and high demand could create the perfect storm for the service in 2017. All in all, it's a changeable forecast for the East Midlands political weather in 2017. Stay tuned for further updates.
Well, we told you she was a political geek, Alex there. So the electrification of the Midland Main Line, Patrick, you were Transport Secretary when that was given the go-ahead, but a lot of our regional MPs, Labour and Conservative, are very concerned now that that's not going to go ahead.
Well, some of the work has already started, and some of the bridge changes that one sees as one goes from the train to Derby to London is underway. Some of the double tracking just outside Corby is also actually underway.
Taking a long time.
It is taking. These are big projects. I mean, the truth is.
Did you expect it would take this long when you were in transport?
Well, the trouble is when you're working on a railway line, which is a live railway line and in operation, it does take longer to do those particular projects. And we embarked on a huge investment as far as electrification across the country, Great Western, the Midland Main Line and others, and progress is being made.
Liz, your Labour colleague Lillian Greenwood is one of the people who's very concerned about it being dropped. Do you share her concerns?
Absolutely. You know, we haven't had a clear commitment about completing that project. And overall, you know, we see 9 times as much investment in rail infrastructure in London as we do in the East Midlands. We need that to go ahead.
Why is
properly.
that ridiculous?
Well, it's ridiculous because when you're talking about that, you're talking about the investment that's taken place in St Pancras Station. You know, I mean, St Pancras Station serves the East Midlands. King's Cross Station serves the East Coast Main Line. So to actually talk about this, you're quite right. There is a big project, Crossrail, which is a big project in London. But that's partly one of the reasons why you've got to do things like HS2. Well, that is a massive inward investment. This government is committed more to transport than the last previous Labour government ever did.
10
miles of electrification.
Patrick, if you let me come in at this point, You know, we still in the East, you know, the last 6 years have done really badly in terms of infrastructure investment. We need that for jobs and growth. We have the world's largest cluster of railway companies in the East Midlands. So, you know, we really need to make the most of it. And we need that because we want jobs and growth in the East Midlands to do even better in future. And if the government wants to rebalance the economy and get an economy working for everybody, it needs to do more for the East Midlands.
I buy that. I buy how important infrastructure spending is.
You agree
but
with
13 years of Labour government, you did 10 miles of electrification in the country. 10 miles. I'd like to say it was snail pace. The truth is snails move faster.
What about saving Glenfield? Your New Year's resolution, I believe, was to help save that and stop plans for closure of the Children's Heart Unit there.
We have some of the best clinical outcomes in the country at Glenfield Children's Heart Surgery
What stage
Unit.
is it all at the moment?
Well, I think the public consultation will be announced later on this month. We've got cross-party support from the MPs there, working very closely with the hospital and campaigning groups.
Do you support this, Patrick
And that's a
McLaughlin,
big,
saving
big
this
thing
heart
for me.
unit?
I think Liz has been doing a tremendous job on that. It's actually is it in your constituency.
It is in my constituency.
It's in Liz's constituency, and
Do you
I think.
support it?
Well, I want to see I want to see people partake in the public exercise because the question is as to heart service across the country, and I think it is absolutely right that that this particular issue is got right.
We don't want to be the only region in the country
I don't think it
without
should
a heart
become a
surgery
party
unit.
political issue. We've got to make sure we've got the right answer for the region.
OK, thank you very much both. Now, time for a roundup of some of the other political stories from the East Midlands this week in 60 seconds. More than 200,000 people have signed petitions against plans to survey Sherwood Forest for shale gas. An exploration firm, INEOS, wants to scan land under the ancient forest to see if there's potential for fracking. Derby is to get a share of government funding to create 9,000 free childcare places around the country. The city will get part of £2 million being allocated to 6 cold spots where lack of social mobility is a major concern. People in Derbyshire are facing higher council taxes to pay for policing. The county's Police and Crime Commissioner, Hardiel Dinser, wants a 2% rise in the amount of tax paid towards policing. It would add £3.50 a year to the average bill and raise about £1 million. Having failed to agree on its own devolution deal, the East Midlands is now throwing a spanner in the works of Sheffield's plan. Elections for a mayor there have been put back for more time to consult on moves by Chesterfield and Bassetlaw to join the Sheffield scheme. And that is the Sunday politics in the East Midlands. Thanks to Liz Kendall and Patrick McLaughlin for being this week's guests. Maggie Throop and Lillian Greenwood will be here next week. But in the meantime, thanks for watching. Time to hand you back now to Andrew Neil.